Hello, everyone. Today we'll be discussing our A-level psychology syllabus. Our syllabus code for A-level psychology is 9990. As many of you would be aware that our A-level psychology syllabus has changed and the new paper structure along with the syllabus would be applicable from 2024 onwards. Now, before we begin, I'd want you all to note that there are certain similarities. We talk about a comparison between this syllabus with the older syllabus that we had. There are certain things that still remain similar. Nonetheless, there are others that have changed. Now, to begin with, and I try to keep on mentioning the parts that have changed, right? So that if you want to put your older past papers to use, you could do them in the right manner. Now, to begin with, when we talk about our A-level psychology syllabus, our A2 psychology syllabus, there are four different components. There are four different components that the CI offers us, and we're expected to prepare for any two of them. Now, the two components that I typically prepare for are clinical psychology and health psychology. The first component that you see over here, that is clinical psychology, this was formerly referred to as abnormal psychology. So clinical psychology, that was formerly referred to as abnormal psychology, number one. So there are four components in total. Out of those four components, you're expected to prepare for any two of them. Now, taking this ahead, we'd start off with the issues and debates. If we speak about these issues and debates, there are certain issues and debates that are uh, to be prepared by us. Now, for these issues and debates, four of the issues and debates, they have been picked up from the AS psychology syllabus. Now, for instance, this first one that we have over here, that is application of psychology to everyday life, or in other words, the usefulness of psychology in everyday life. Number two, individual versus situational explanation. Number three, nature versus nurture debate. And the fourth one over here is the use of children, right? The use of children when it comes to psychological psychology or psychological researches rather. Now, there's this fifth additional issue that we have that we teach in AS, but that is no more a part, or that is not a part of A2 psychology syllabus. That is the use of animals in psychological research. So that is not applicable over here. So these four, we've already studied them in AS. And additionally, there are four more that need to be prepared now, right? Prepared for now. And they are number one, cultural differences, the extent to which a study being conducted or research being conducted in one part of the world, the likelihood of its findings being generalizable to other parts of the world. One. Number two, we'd speak about reductionism versus holism. Number three, determinism versus free will. And the fourth one is ideographic versus nomothetic approach. Now, this eighth point that you see away, this eighth issue, that is ideographic versus nomothetic approach, this is a recent addition to our syllabus. And this, for what I recall, this used to be tested pre-2012. Pre-2012, that is before the papers that we had in 2012, nomothetic and ideographic approaches were taught and tested. But then for good about, say, 12 years, the CI chose not to do so. Now, about this ideographic versus nomothetic approach, if I put it in a simplistic manner, we typically use the term ideographic approach when we're referring to researches being conducted in a manner that the findings would be applicable on a single individual. Nonetheless, when we speak about nomothetic approach is we use the term nomothetic approach when researches are conducted in a manner when there are psychological findings that are that ought to be applicable for the wider population. Of course, this is a very simple manner in which I'm trying to explain this to you, just so that you know that just so that you have a basic idea of what this is. Now, moving on. What I explained so far is initially we spoke about issues and debates. There were four issues and debates that were taught in AS that you already should be aware of, and there are four more that are added when it comes to A2s. So in total, there are 8 issues and debates that you all need to prepare for, right? Amongst these 8, this 8th one that we see over here, ideographic versus nomothetic approach, this is a recent addition. So along with this, along with us knowing our issues and debates, and along with us being able to apply these issues and debates, we should also be aware that we would be tested on research methodology. Yes, you heard me right. The research methodology that you studied for paper 2, that is research methods, they are applicable. They're very much applicable, and they ought to be revised because you would be tested on them specifically when it comes to paper 4. Now, we know that there are 4 components. Out of these 4 components, 2 of them have to be studied. We know that there are 8 issues and debates that are to be catered. Now, if you have a look at the syllabus Additionally, it does mention that these are the research methods which are relevant to some of A-level studies, some, not all, right? Number one, experiments. You should be able to describe and evaluate the main features of randomized controlled trials, also referred to as RCT. Next question is describe and evaluate the use of postal questions, describe and evaluate the use of rating scales, force, and fixed choice question. I'm fixed choice options. Now I'm just reading through this because, of course, if I try explaining each single point over here, it's going to take us quite a bit. Now, nonetheless, if you've studied AS, I don't think there would be any problem in you understanding what these terms are and what the examiner means when the examiner talks about them being described and explained. Now, methodological concepts which are relevant to all of the A-level specialist options. Now, over here, this says some, over here it says all. So, number one, psychometric tests. Number two, a hypothesis. Number three, validity. So, this has to be kept in mind. Taking this ahead, assessment objectives. I find it pretty sad that many students, they typically do not even, there are many students there are many students I come across who do not even know what assessment objectives are. Assessment objectives, if I put it in a simple manner, the the core ideas or the things that you're actually being tested on or assessed on, right, by the CIs. So assessment objectives, these are the things that are being that the CI expects that you would know, and then you would be tested on, right? So we have three major assessment objectives that are to be taken into account. Number one, we have AO1, followed by AO2, followed by AO3. So we have AO1, AO2, and AO3. AO1 over here is knowledge understanding. You'd be tested on knowledge understanding. Number two, AO2 is application, how good you are when it comes to you being able to apply the knowledge and understanding that you've gained. And number three has to do with analysis and evaluation. I'd really appreciate if you guys could simply pause this video over here and read through this, or you might as well take a screenshot of this and read this thoroughly so that you understand what actually AO1, AO2, and AO3 is, because guess what? You need to demonstrate this to be able to score well, because this is the criteria that is typically used by the Cambridge, by the CEIs when it comes to scoring you or marking you. So after being done with assessment objectives, let me show this to you all. This would allow you to understand, I mean, this would help you understand the significance of these assessment objectives in a better manner. So if we speak about paper three, if we talk about paper three over here, according to the new syllabus, according to the new paper structure, 26% of your paper is based on knowledge understanding for paper three. 26% of your paper is based on application, how well you're able to apply the knowledge that you've gained. And 48% of your paper relies on analysis and evaluation. So now that you know, I mean, you could always go back to the CI website and double check on the information that I'm providing you over here. So now that you know what AO1 is, or what the weightage of AO1, AO2, and AO3 is, you might as well go back and read through these again so that you know for paper three, what matters the most is your AO3. That is analysis and evaluation. And then 26 plus 26 marks, 26 plus 26% together if you talk about AO1 and AO2 combined. Likewise, if I take this ahead and I speak of paper four, in paper four, you are tested on knowledge understanding for 26% marks. For application, you tested worth 44% marks. And for analysis and evaluation, it is 30% marks. So this is how you would understand, which I hope you do. This is how you'd all understand and realize how significant these assessment objectives are and how important it is for us to know them well. Unless we know them well, we wouldn't really be able to apply them. And unless we do not know how to apply them, we are missing on an opportunity to understand the CI marking mechanism. So in a nutshell, if we speak about the relationship between assessment objectives and qualification for A levels, that is A2s over here, in total, AO1 is tested 30%, AO2 is tested 35%, and AO3 is tested 35%. So yeah, you heard me right. More than you holding knowledge and understanding on your subject matter, you need to learn how to apply it, and you need to learn how to analyze and evaluate it, right, your syllabus content. Now, just in case, an additional point that I'd like to bring in, knowledge understanding over here is, there are so many kids who will be like, oh, I've learned the chapter. If you've just learned the chapter, if you've just learned the content of the chapter, you're actually relying on knowledge and understanding. And you do see how knowledge and understanding, I wouldn't say is not important. It is important, but it is just worth 30% marks. Along with you holding that knowledge and understanding, you should be able to apply it. Now, there are some students who might confuse this with assuming that they could not do AO1, or they could not cater to AO1 and directly go to hop onto AO2 and AO3. I would like to remind you all that until and unless you have knowledge and understanding on something, you would not be able to apply it. You'd not be able to analyze it. You'd not be able to evaluate it. So it works in an order, right? So you first have to gain that knowledge and understanding, and after you've gained that knowledge and understanding, then you learn how to apply it, and then you learn how to scrutinize, analyze, and evaluate it. Now, taking this further, if I move on towards the paper structures, we have two papers for A2 psychology, that is paper 3 and paper 4 respectively, where paper 3 is referred to as the theory paper, right? Paper 3 is referred to as the theory paper, and paper 4 is referred to as the application paper, right? Now, talking about paper 3 first, as we move on and we speak about paper 3. Paper 3, in paper 3, you'd have to attempt all questions. Yes, there is no choice when it comes to paper 3. Let me just write it down over here. Okay, there's no choice when it comes to paper 3, right? Now, all questions have to be attempted from respective specialist options. Now, remember when right at the beginning, when I said we have 4 specialist options, or we have 4 components in total, and out of those 4 components, you're expected to prepare for any 2. Yes, the CIE expects you to study only 2 of them, because it's like I had mentioned a minute back, it's not only about reading through the syllabus, it's not only about gaining knowledge over the syllabus. You need to cater to other aspects, such as analyzing, such as evaluating, and such as applying it as well. So there are 2 components that you need to prepare for. And when you'd come across your paper, when you'd have a look at your paper, you'd see that you have questions 1, 2, 3, and 4 based on clinical psychology. And then you would have questions 9, 10, 11, 12 for health psychology. I think I should take you ahead so that you could have a look at how the paper is like for a better understanding. So this is how your paper would be like. The paper, I'm talking about paper 3 over here, right? So paper 3 is of an hour and 30 minutes. In paper 3, you're expected to answer 8 questions in total, answer questions from 2 options, right? The examiner has emphasized on 2 over here. Answer all questions from the options you have studied. When the examiner says you have studied, the examiner is very clear that the examiner does not expect you to study all of the specialist options or all of the different components that we have. So taking this ahead, yeah, additionally, this paper is of 60 marks in total. Moving on. Now have a look at this. So this is how your paper would look like, right? This is the cover paper, right? And then you'd come across a paper, you'd come across the first page. That is, if I zoom this, this says answer questions from 2 options. Answer all questions from the options you have studied, right? Answer all questions from the options you have studied, right? So like I had mentioned earlier, I teach clinical psychology and I teach health psychology. This is how your paper looks like. So you get a 4-mark question. Question 1 is of 4 marks. Question 2 is collectively of 4 marks. Question 3 collectively is of 6 marks. And question 4 collectively is of 16 marks, right? So the reason I've opened this over here is to show you how the actual paper looks like, and to show you why it said that you have to attempt question number 1, 2, 3, and 4. And then you have to attempt question number 9, 10, 11, and 12. So because question number 5, 6, 7, and 8 would be based on consumer psychology, right? Now, because I do not teach consumer psychology, I expect you to not even have a look at these questions, right? Because those 90 minutes that you get, you need to, every single minute counts. Do not get distracted. Don't even have a look at it. Just see section B says consumer psychology, skip, and you move on to the next section. So 5, 6, 7, and 8, you would not even read if you haven't studied consumer psychology. Moving on, question number 9, 10, 11, and 12 over here would again be from health psychology. So what I had said earlier was I expect you to attempt question number 1, 2, 3, and 4, and then skip 5, 6, 7, and 8, and then attempt 9, 10, 11, and 12, right? And then you'd have to, I mean, by the time you're done with this, you'd be done with the paper. Let me just show you question number 13, 14, 15, and 16 respectively are from organizational psychology. I've put a crossover here because I do not teach this particular specialist option or this particular component as well. So this is how your paper 3 looks like. About paper 4, we'd move on and talk about it later. Getting back to where we were. Yeah, attempt all questions. All questions have to be attempted from the respective specialist option. Question number 1, 2, 3, and 4 from clinical, and 9, 10, 11, and 12 from health psychology. Maximum marks over here, 30 marks for each component, right? So it's a 60-mark paper. You get 30 marks from this part, that is health psychology, and you get 30 marks from this part, that is clinical psychology. The paper is of an hour and 30 minutes. That makes it 90 minutes in total. Yeah. About these questions, like I'd shown you, they're the same. If you compare this side with this side, you'd see that they're exactly the same in terms of paper structure. Question 1 would be a 4-mark. Question 2 would be a 4-mark. Question 3 would be of 6 marks. Question number 4 would be of 16 marks in total, divided into 6 and 10. And so is the case with health psychology. Now, this is about paper 3. Paper 3, remember, we refer to it as the theory paper. Moving on towards paper 4, if you have a look at paper 4, which we would refer to as the paper that tests us more on applying the knowledge that we've gained. Now, unlike the papers that used to be there, that is pre-2024, from 2024 onwards, now there'd be 2 sections and not 3. So pre-2024, we used to have 3 sections, and now we'd have 2 sections in paper 4. 2 sections in paper 4, it's a 60-mark paper. We have section A that is of 36 marks, and we have section B that is of 24 marks. For section A, you need to attempt questions from both the components. So if I speak about section A, I'm talking about section A over here, there's no choice in section A, in paper 4. Paper 4, section A, there's no choice. So you're getting questions on clinical psychology and getting questions on health psychology. I'm referring to these both because remember, like I said, these are the 2 that I would be teaching you all, right? So section A is of 36 marks. The section from in this particular section, you'd be expected to attempt questions from both the components of both the specialist options that you've studied. In our case, it would be clinical psychology and health psychology. However, if we speak about section B, in section B, yes, you do have choice. You do have choice in section B, and you need to attempt any one. So you'd get a question which you'd have to attempt either from clinical psychology or health psychology, right? So again, this paper is of 60 marks. This paper is of an hour and 30 minutes. The paper is divided into 2 sections, A and B respectively. Paper A is, section A is of 36 marks. That comprises of 2 questions of 18 marks each. Question number 1 and 2 have to be attempted from clinical psychology. Question number 5 and 6 have to be attempted from health psychology, right? And it would be pretty similar to how I was showing you paper 3 as to how you need to attempt the questions. You need to attempt only the questions that you have prepared for, right? So section B over here, 24 mark. Section B is of 24 marks again. And you have to attempt any one question. So you either attempt question number 9 or you attempt question number 11, right? Just in case, for section A, it says attempt this and this, right? So you need to do both. For section B, it says attempt this or this, either question 9 or question 11. So it says or, right? So there's a choice here. Students have to answer 5 questions in total. How do they make up 5 questions? You need to attempt 4 questions from section A, 2 from each. That is 2 questions from clinical psychology, 2 questions from health psychology. And the 5th question has to be from section B, either from clinical or from health psychology. Now, I hope this has helped so far. Taking this ahead, having a look at the syllabus further. So if we speak about the syllabus for health psychology, if we speak about the syllabus for clinical psychology, again, we have 5 different units over here. I am using the word unit over here. You might as well refer to them as chapters. So We have 5 different units over here. To name them, we have schizophrenia, we have mood or affective disorders, we have impulse control disorders, we have anxiety disorders and fear-related disorders, and we have obsessive compulsive disorders. So these are 5 different chapters or 5 different units that you all need to prepare yourselves for. Let's take this ahead quickly and discuss a bit more, and discuss these units and what we'd come across within the syllabus of these units over here. So if we take this ahead, if I take this ahead, so yeah, each unit is divided into 3 different sections. I'll mark it over here so that it's easier for you to understand. So here, what I'm saying is each unit is divided into 3 different sections. So each unit would be divided into 3 different sections: section A, section B, and section C respectively. Yeah, you could name them as section A, section B, section C, or you could name them like this. This is what I'm talking about. I'm just highlighting this in green so that you know what I'm talking about. Do you see how this unit schizophrenia is divided into 3 different parts? The first one being, see, if this is 1.1, this is 1.1.1, and this one is 1.1.2, and this one is 1.1.3. So schizophrenia, the unit itself, is divided into 3 different parts. Like schizophrenia is divided into 3 different parts, the other 4 following units or the chapters that we have on clinical psychology would again be divided into 3 different parts like this one. So would be the case for health psychology as well. There are 5 different chapters or 5 different units that we have in health psychology. To name them, we have patient practitioner relationship, we have adherence to medical advices, we have pain, we have stress, and we have health promotion. So all 5 of these chapters or all 5 of these units would again be divided into 3 different parts each. Now, what is to be what more do we need to know about? Now, I would want all of you to keep in mind that unlike what used to happen back in the past, if we have a closer look, we'd realize that each unit or each component now has a key study. So we have a key study that is a part of every unit, that is every chapter. So for schizophrenia, the key study we have is this one that was conducted by Freeman et al., right? Now, for mood affective disorder, we have this key study that was conducted by Orek et al., right? For impulse control disorder, we have this key study that was conducted by Grant et al. For anxiety disorders and fear-related disorders, we have this key study that was conducted by Chapman and Delap, right? For obsessive compulsive disorders, we have this key study that was conducted by Lowell et al. In 2006. So what I want you all to know now is that each unit or each chapter would have a single key study. So in other words, you'd have 5 key studies from clinical psychology and you'd have 5 key studies from health psychology. That totals up to 10 key studies for you as a student to know when it comes to preparing for your examination. So these are 10 key studies. And as the examiner refers to this as a key study, I think it's pretty essential for you all to realize that this is the core component, or this is the, now let me avoid using the word component over here. This is the core part of the syllabus. These are the most important studies if you talk about a syllabus. So yeah, each unit again is divided into different sections. Each section is divided into different parts. Now, if I talk about one particular section over here, for the sake of an example, I'm just picking up this first section from unit 1 here, this first one, right? Now, this first section from unit 1, do you see this part? Let me highlight this in purple again. This says relevant issues and debates and methodology for this topic include. So in paper 3, if we speak about paper 3, in paper 3, the fourth question that we had for clinical psychology that had 2 different parts. One of them had to do with you being expected to describe, and the other having to do with you being expected to evaluate. This description question was of 6 marks. The evaluative question was of 10 marks, right? So remember, we had spoken about certain issues and debates right at the beginning when I was explaining you the syllabus right at the beginning, issues and debates part. For each particular section, right, remember the hierarchy. We started off with components. From components, we spoke about units, right? From units, I'm moving on to sections, right? This is a section, this part that I've highlighted over here in green. So for each section, the examiner or the CIE has recommended a couple of issues and debates along with methodology that we could evaluate our studies on. So for instance, if I talk about this particular section, that is diagnostic criteria for schizophrenia, we might as well be able to evaluate the content that we study over here in terms of individual and situational explanations. We might as well be able to evaluate our content over here on the basis of the use of children. We might as well apply or put the ideographic versus nomothetic debate to use. We might as well be expected to evaluate in terms of the usage of case studies or, for the matter of fact, generalizations from findings. So what I'd want you all to understand at this point is every section has its own recommended issues, debates, and methodology that you could evaluate on. Now, additionally, a frequently asked question at this point is, are we restricted? I mean, this is a question that I come across from a lot of students. They'd be like, is this what we only supposed to evaluate on? Not necessarily. This is content that has been, I mean, these are issues and debates and methodology examples that the examiner has suggested that you could put to use. If you want to evaluate on something beyond this, yes, you're totally allowed to. Nonetheless, if you do have a basic know how on the syllabus material prior to watching this video, you would know that the evaluative question towards the end hints on a named issue. So what I expect from the examiners to do is probably give us, probably use something from here when it comes to questioning us on through questioning us or including this or making this a part of the named issue. I'll show it to you when I get to that specific question. But for now, what I want you all to keep in mind is every section has its own list of issues and debates and methodology that the examiner suggests you could put to use. Now, another frequently asked question at this point is, oh, this is so much and this is I'm getting overwhelmed, right? There are many students who feel overwhelmed by this information. No, you should not. If anything, the examiner has made things easier for you. The examiner is telling you out of these, you could always, the examiner is suggesting, or if the examiner is offering a helping hand to you, that you could actually put these points to use, right? One. Number two, this helps you better with the preparation as well. When you're preparing, I at least expect my students to prepare for these evaluative questions beforehand, before they go and sit for the paper. So you need to realize that this is, you could use these as the evaluative points. And if you've prepared 4 evaluative points for each section, I don't think you stand any chance on missing out on any mark when you come across that 10-mark question. And remember, you don't even get you don't even come across one of these 10-mark questions. You come across a 10-mark question from clinical psychology as well as health psychology. So that part I try to elaborate on after a bit. For now, I hope I'm clear with what I wanted to explain by putting this red mark over here and highlighting this into purple when I had spoken about relevant issues and debates and methodology for this topic. So so is the case with this one, so is the case with this one. Now, additionally, if you have a closer look at this, do you see this? If I may read this point, I'd like to highlight this one in purple now. Okay, so this part. If you have a look at this, this comes under the heading treatment and management of schizophrenia. And the point over here, the bullet over here reads psychological therapy, that is cognitive behavioral therapy, including a study, example study, Sensky et al. Now, this is an example study. What is the difference between a key study and an example study? A key study would be more detailed. You're expected to know more on the key study as compared to an example study, the difference between them. Now, there are 5 key studies if I talk about clinical psychology, and there would be 5 key studies when you talk about health psychology. Nonetheless, if I start counting these example studies, you have 10 example studies in clinical psychology, and you have 20 example studies for what I recall for health psychology. So yeah, The similarity between them, oh wait, did we speak of the similarity? Yeah, that's the difference between them, right? So if I hop on to the similarity, remember, anything that is mentioned in the syllabus, you could directly get a question on. Let me repeat what I said. Anything that is mentioned that is specified in the syllabus, you could get a direct question on. And yes, you might get a direct question on Freeman's study because this is a key study, of course. But if I talk about these example studies, you need to know details on these example studies as well, because I mean, there's a possibility that you might end up getting a direct question on example studies as well. So I think I did mention the similarity and the difference between these two. Taking this ahead, this is the second unit, that is mood affective disorders, depression, depressive disorder, unipolar and bipolar disorder. Again, the same idea, the same criteria. This highlighted green part are the sections. Oh, this one is highlighted already, so I just remove this so this part, yeah. And if I may take this ahead in the purple, if you see this as purple and not light blue. And this purple part, these are the relevant issues and debates under each section. Here you go. And then here you go. And then here you are, right? So about the key study, yes, the key study over here is the study conducted by Orrick et al. And the example study by Seligman et al., right? Now taking this ahead, so would be the case for impulse control disorders. Here you go. That's the name of the unit or the section, or the unit or the chapter. This is the name of the chapter or the unit. This is the name of a section. This is the first section, the second highlighted part in green, the second section, and this being the third section. About the key study, yes, here is where the key study is. And along with key studies, do you see there are two example studies over here? The first one by Glover et al. And the second one by Bludzinski and Noer. Taking this ahead, if you move on towards the fourth chapter or the fourth unit, again, the green highlighted part refers to the section. This numbering that you come across over here are the example studies. Do you see how anxiety disorders has more example studies than the rest? And that clearly signifies that the examiner does not, or the CI principal examiner does not have any fixed rule set for example studies. I mean, a unit could have one of them, a unit could have two or even four, maybe more too. So over here, the treatment and management of anxiety disorders. Under this, there's this case study by Chapman and Delep, and this is a recent edition. This was not a part of the syllabus prior recent edition, and pre-2024, this was not a part of the syllabus, okay? Now, taking this ahead, likewise, here again, these are the relevant issues and debates, and just quickly highlight this so that you all know what I'm actually referring to. The fifth and the last unit, that is obsessive compulsive disorder. Again, these are the sections, the three different sections over here, highlighted in green. The relevant issues and debates. Mind it, I had said this, the examiner putting them on the syllabus has made our life easier and not difficult or complicated. We have been suggested to use this. Nowhere does it say that you only have to do this, right? So yeah, if anything, we should understand the hint that probably that the question that we'd receive from the examiner would revolve around these only. Taking this ahead, this has two example studies over here. The first one by Rappaport on this young boy known as Charles, and this example study by Lemkel et al. That was conducted in 2008. So these are example studies, this 9 and 10, and this is a key study, the fifth and the last key study when it comes to clinical psychology. So that being there, quickly hopping on to health psychology. When we speak about health psychology, we have 5 different chapters or 5 different units, as I had mentioned earlier. So the chapters or the units that we have over here are: number 1, the patient practitioner relationship; the second one, adherence to medical advice; the third one, pain; the fourth one, stress; and the fifth one is health promotion, right? Taking this ahead, so is the case. The green part over here that I'm highlighting, it green signifies different sections. Look at this key study that has already been marked over here. These numbers that you come across over here with yellow highlights, these are example studies. If you recall, what I said was for clinical psychology, you have around 10 example studies that are part of your syllabus. For health psychology, you have 20 of them, right? So yeah, what I'm trying to do over here is to walk you through the syllabus to help you understand the syllabus better. And nowhere did I say, I mean, you if there are many kids who would be like, oh, why is it that clinical psychology has fewer example studies and health psychology has more of them? Number one, I did not design the syllabus. Number two, I believe health psychology is relatively easier. So probably, I mean, that's just what I feel. And yeah, so taking this ahead, the purple part again reflects the relevant issues and debates that could be put to use along with others. Now, taking this a step further, moving on to the second unit of the second chapter, that is adherence to medical advice. If you have a look at this, these are the three sections. Along with the three sections, these are the relevant issues and debates in purple. And this is a key study by Yockley and Glenwick. However, these are the numbers that you see over here as 5, 6, 7, and 8. These are all example studies. So let me remind you all, example studies are not to be ignored. You are to be tested on them, right? So you need to know these example studies. You probably do not need to know them as well as you should know the key studies, but nonetheless, you should know about the aim, about the sample, about the research design, about the procedure, about the result, about the conclusion. So yeah, and should be able to evaluate and apply the findings as well. Now, about these four different example studies that I've marked over here, this one by Laba et al. And this one, the 8th number, Cheney et al. These are recent additions. These were not a part of the syllabus prior to 2024. However, Reichert and Tote and Chung and Naya, yes, they were part of the syllabus. Taking this ahead, moving on to the third unit for health psychology, we have pain. The ones highlighted in green are the uh, sections. Highlighted in purple are the relevant issues and debates and methodology. The numbers over here signify example studies and this key study. And both this and this, they were not a part of the syllabus pre-2024. So this is a recent addition, and you might not come across them if you're trying to get some help from the previous past papers. Nonetheless, be careful, be super careful if you are dealing with older past paper questions. I'm not trying to discourage you, but the likelihood of you confusing things is always there. So if you want to use questions from prior or the older past paper questions, make sure that you know this syllabus really well. You should know your syllabus well so that you do not end up confusing one thing with another. And additionally, you do not end up studying for something that is no more a part of the syllabus. The fourth unit over here is stress. Here you go. Green signifies different sections. Purple signifies relative issues and debates. And these numbers over here, that is 10, 11, 12, 13, 14. All of these, they signify example studies. And this is the key study. Now, these studies, they have been a part of the syllabus earlier as well. So you might be able to gather some content on them from the older past paper questions. The last unit that we have, or the last chapter, is health promotion. These are the highlighted in green are the sections, highlighted in purple are the relevant issues and debates and methodology. The numbers that you come across over here are all example studies, which have been a part of the syllabus pre-2024 as well. Nonetheless, this key study, this is a recent addition. This you have not been, I mean, this you might not come across any question at all pre-2024 past paper questions. So I hope I tried to keep it super quick, but I hope you all do have a basic understanding on your syllabus and the chapters or the units that are there, and the sections that they have, the sections within them, right? So this is what paper 3 looked like. I had shown this to you a little while back. A quick recall, and we move on. So you attempt questions from clinical. If you've studied clinical psychology, you attempt this question, this question, this question, and this question. And for consumer psychology, I mean, you haven't studied it, you might as well just skip that page. Health psychology, so is the case. Organizational skip. Now, moving on to paper four, I just quickly show you paper four, how paper four looks like. Again, an hour and 30 minutes. Answer 5 questions in total. As I had mentioned earlier, you'd need to attempt 4 questions from section A and 1 question from section B. This is when you're expected to design or plan the study. Yes, you heard me right. The question that I've seen many students dread on. I don't think it's that difficult, but yeah, I've seen many students complain about this particular question. Yes, for AS psychology, you tested on paper 2 on this. Nonetheless, you come across this question in paper 4 as well. And remember, for this particular question, you need to be super good with your research methods. So the name of this paper is Specialist Options paper, that is applying application research methodology, also referred to as the application paper. This paper is of 60 marks again too. So we have 60 marks in total and we have 90 minutes to appear for. That technically means you have 1 minute and 30 seconds per mark, right? So 1.5 minutes per mark, right? Basic calculation for 10 marker, you shouldn't spend anything more than 15 minutes. Basic calculation for 6 marker, you shouldn't spend anything more than 9 minutes. Do the calculation and you'd understand it better. So this is section A again. There are 2 questions over here. This is paper 4. This is paper 4, section A. Answer questions from 2 options in this section. So this is, you'd have 4 options: clinical psychology, clinical psychology, consumer psychology, health psychology, and organizational psychology. Attempt only the questions that you have studied. Even the examiner is saying it over and over again. Attempt only the options that you have studied, okay? Now, taking this ahead, these are the questions that we have. See, from the study by Freeman et al., do you see this question is from the key study? This is an example of the key study, right? I could go into detail, but this video is going to end up being, ending up being super long. And I'm not sure if many of you would want me to get into that much of detail. So I leave some work for you to be doing, leave some work for you as well. So just to show you that this question that you have over here is from the key study and it specifies it's from the key study, okay? Explain the sampling technique. Look at the details that you've been asked. Used to recruit. Explain one reason why Friedman et al. Did not use participants with a history of mental illness. This shows that your grip on that particular key study needs to be super strong. The B part suggests how one sampling technique could have been used to recruit participants for this study other than the technique that was used by Friedman et al. So again, they're trying to see how well can you apply your grip, apply your knowledge on research methodology. The C part over here reads, explain one strength and one weakness of using students as participants in research using app virtual reality. So again, a demonstration of how well you can apply your knowledge on research methods. So this being there, the second question over here reads, case studies are often used to study fear-related disorders such as phobias. Outline the psychodynamic explanation. The psychodynamic explanation of phobias. This is a typical 2-mark question. I'd want to, and this would take me a bit, but I'd want to take you back so that I show you what part of the syllabus has then this been picked up from. So do you see this is what we're talking about, this part? This is so colorful already. I'd have to pick up another color. Let's just say I just pick. Orange maybe. So if you have a look at this, we have the psychodynamic explanation that you're being expected to be, that you're expected to write down about. So yeah, this, you had a 2-mark question that I was showing you. This is where it comes from. What unit is this? This is the unit. Wait, this is the unit. This is the section. This is that exact part of the syllabus that you're being tested on. Taking it ahead. Suggest how the psychodynamic explanation can explain why individuals differ in the development of phobias. So again, your grip on the psychodynamic explanation should be good enough. Explain one strength and one weakness of using case studies to study phobia. Again, your grip on case studies from research methodology and your grip on the syllabus that is phobias. Taking this ahead, moving on. So you'd skip on question 3 and 4 because you have not studied consumer psychology. You'd quickly hop on to health psychology and have a look at this. So from the key study by Yockley and Glenwick, again, you are being tested on a key study, right? Outline two of the experimental conditions used in the study, two of the experimental conditions. Suggest why Yockley and Glenwick included two controls. Explain two weaknesses of conducting field experiments to study participation in immunization interventions in communities. So this is, yeah. So taking this ahead, moving on to this next question that we have over here, that is from the unit pain. And the question over here reads, the UAB pain behavior scale can be used with patients in hospital. It uses repeated observations to measure changing levels of pain. Describe how this scale is used with a patient in hospital. Suggest why it is important to use repeated observations to measure changing levels of pain. Explain one strength and one weakness of using this scale to measure pain behavior. So this is, I think, I just quickly show you where this comes from the syllabus as well. So this is here, this one. I just highlight it in orange. So this is where this comes from. All right. Now, taking this ahead, this was the specimen paper that I was showing you. We have spoken about section A, right? So what we've understood so far is, since we've studied clinical psychology and health psychology, we would be attempting question number 1, 2, then we'd skip 3 and 4, and then we'd attempt 5 and 6, and then we'd skip 7 and 8. And then we'd move on towards section B. And from section B, you're expected to attempt any one question, right? Any one question. So you're expected to read through the question from clinical psychology and read through the question from health psychology thoroughly before you start attempting this. So schizophrenia is, again, schizophrenia can be treated biochemically with drugs such as antipsychotics, but they're not always effective. You're expected to plan a study. This was formerly known as designing a study. Now the examiner refers to it as designing a study. So for this particular question, this is another detailed video that I've put, and I'd try to add the link of that video in the description for this one. So just in case you're interested, you might as well go through that video. That would enhance your understanding on this. So what we understand from here is, in section B, we are expected to attempt any one question, having a look at the marks over here. So this part is of 10 marks. This part, as we see, is of 8 marks. And this part, as we see, is of 6 marks, right? So 10 and 8 make 18, and 6 more make 24 marks, right? So 24 marks from here, and that is it. So, I mean, this is a question from the health psychology part as well. So from the health psychology component as well. Now, a few additional things that I'd like to show you before I could end this. Yeah. All right, here is a list of the command words that the CI has mentioned. Cambridge Examination, ASN A-Level Psychology 990 syllabus for 2024, 2025, and 2026 onwards. Detail 2026, right? For these 3 years being specific. There are a couple of command words that I'd want all of you to know well. Why is it that I would want you all to know well, to know these command words well? That's because these are the words that the examiner would use, and this is what they mean when they're using this word. So analyze is examine in detail to show meaning, identify elements and the relationship between them. Compare is when you're expected to identify, comment on similarities and or differences, and or define is give a precise meaning, right? Precise. Describe is state the point of a topic, give characteristics and main features. Evaluate is judge or calculate the quality, importance, amount, or value of something. Explain is set out purpose of reasons, make the relationship between things clear, say why and or how, and support with relevant evidence. So yeah, I'd put this here. Okay. Now, produce an answer from, give is produce an answer from a given source or recall a memory. Identifies name, select, or recognize. Outline is set out the main points. State is expressed in clear terms, and suggest means apply a knowledge and understanding to situations where there are a range of valid responses in order to make proposals, put forward considerations. Now, this part, phrases such as plan and experiment, investigation, or study may also be seen in the assessment for this syllabus. So this, like I said, this was previously known as the designing a study part. Now, I would want to additionally, I would want to to explain one more thing to you. Allow me to. So I'll just pick this up and I just walk you through the questions that we've had quick. I try to keep it as quick as possible and see if we drive something out of it or if we learn something out of it. If I pick up questions from uh, this part, right? So this is paper 3. I've opened up paper 3 and I've opened up clinical psychology part. If I see this is a question that we have from mood or affective disorders. So question number 1 is on mood and affective disorders. And question number 3 is on mood and affective disorders too. Question number 4 is on OCD. So we in paper 3 for clinical psychology, you are being tested on this particular unit, that is mood or affective disorders, and you're being tested on OCD, right? I'll just mention them and then towards the end, I'll tell you why I'm doing this, okay? So clinical psychology, I'd go to the end here. So we're talking about paper 3, clinical psychology. You tested on mood or affective disorders, and you tested on OCD. Okay. Moving on to paper 4 for clinical psychology again. Okay. So that's health psychology. Take it ahead from here. So if you have a look at this, we are being tested on we have this question from the unit schizophrenia. Okay. And then question number 2 is on phobias. So we tested on schizophrenia and phobias. Schizophrenia and phobias. Paper 4, section A, you've been tested on schizophrenia and phobias, right? Let me remind you all, just in case if you've lost track, this was chapter or unit 1. This was chapter or unit 2. This was chapter or unit 4. And this was chapter or unit 5, okay? So we still left with having a look at this one. So uh, again, the question that we have over here is from schizophrenia. That is section B, paper 4. Section B, paper 4, we have been tested on schizophrenia. Okay, this is section B, right? Paper 4 again. Let's move on to health psychology. Initially, we talk about paper 3, then we move on to paper 4. Paper 4, section A, paper 4, section B, okay? Now, this is health psychology. And if you have a look at this question, this is on stress. And we have, this is on stress. And this is on patient-practitioner relationship. So we have a question on stress and patient-practitioner relationship. So we have this question on stress, and we have a question on patient-practitioner relationship. Okay, so this being the first unit and this being relationship. Okay, and this being the fourth unit. Okay, now moving on towards this part. So you have the study from adherence to medical advices, and you have a question from pain. It would say pain somewhere. Here you go. So this is about adherence to medical advice, and this is from pain. Adherence to medical advice and pain. and this is pain. So this is unit number 2. This is unit number 3. Now the last question here. So plan a study to investigate non-adherence to medical requests. So this is again from the unit adherence to medical advice. So this is what we're talking about. That is adherence to medical advice. Okay. That happens to be unit number 2. Okay. Now have a look at this. Do you realize the questions that you've had in paper 3 and paper 4, they're from different units, 2 and 5, and then 1 and 4. Over here for health psychology, it is 4 and 1, and this is 2, 3, and 2. Okay. Now, this again, if you understand this, this would help you prepare for both of the papers in a better manner. I mean, I could go on and on and on, but I understand this has taken a lot of time already. I hope this has been helpful. Take good care of yourselves. Thank you. Allah Hafiz.